why does it seem that infections are more common in eczema children, and what do I look for?
Yeah, so like we talked about, those high levels of staph and sometimes strep can cause bacterial infections in a child. So what infections in eczema look like is your classic, there tends to be a yellow weep to the skin, or yellow pustules to the skin, or sometimes little white pustules. So those kind of are signs of an infection. Sometimes that can be in a small area, or sometimes it can be widespread. So definitely always seeing medical attention if you notice signs of yellow in your child's skin, because that sounds like a bacterial infection. There are other infections we can get in eczema. And so there's common childhood viral infections which happen. So our hand, foot and mouth, our molluscum, those kind of infections are really common viruses that we get.
Okay.
What happens in eczema, and if you think again about the brick wall, is that the spread of those can be so much more severe. So molluscum is a tiny little, almost pearl-shaped little warty kind of virus, which children can get, also known as water warts. And some children might just get a cluster of those, and they can last a reasonable period, but they don't spread a lot. Whereas eczema children tend to get a more severe dose of it because of that brick wall.
Yes.
So, and they also have because of the staph content, that can get secondary infected with bacteria as well. The same with the cold sore virus. So if someone has a cold sore and their child has eczema, they can end up with something called eczema hepaticum. So if your child has got lots of bumps on their skin that have come up and it looks infected and they're unwell, really important to get them seen by your GP.
Yeah.
Because there are certain viral conditions which can definitely make a child unwell because of the eczema.
When treating an infection in a child that has eczema, at that point, are antibiotics needed to treat it?
So there's different levels of skin infections when we need to treat them. With our viral infections, absolutely no. Our molluscums and our hand, foot and mouth and stuff, we don't need antibiotics for, because they're viruses. Sometimes we can get bacterial infections on top of those.
Oh gosh.
If there's yellowing, then we do need antibiotics. So if the child has widespread infected eczema where there's yellow weep and there's yellow crusting and there's pustules, then often they will need oral antibiotics. If it's really severe, sometimes we admit children to hospital if it's a really severe infection.
Okay.
But lots of it can be managed in the community. And then some mild infections with our bleach baths and stuff, we don't always need to use oral antibiotics. We avoid using topical antibiotics now. So that antibiotics that we put on our skin, we no longer use those for eczema much because of antibiotic resistance. So we can use sometimes an antiseptic cream like Cristoderm.
Oh yeah.
But otherwise we're bleach bathing and using those, but definitely getting our child, if we think a child's got a skin infection, it's getting them to see a doctor in case they do need oral antibiotics.
So if you suspect infection, go to your GP.
Yeah, absolutely.
For treatment.
Absolutely.